Welcome back to The Healthline, issues that shape our well-being. I am your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights to help us gain a better understanding of our ever-evolving complex healthcare system. In today's episode, we are happy to welcome patient advocacy and care coordinating extraordinaire Nicole Christensen to The Healthline. Nicole is the CEO and founder of Care Answered, a patient advocacy and care coordination organization. Nicole also recently launched another organization called Answers for Care, and we will learn more about both organizations in a few minutes. Nicole is an award-winning board-certified patient advocate and best-selling author of the book From Crisis to Calm. With over 25 years of experience in advocacy for older adults, she is a renowned expert and has been featured in newspapers, radio programs, webinars, and television, as well as addressed audiences as keynote speaker and other roles as well. Nicole earned a Bachelor of Arts degree in psychology from Baruch College and a Master's of Science degree in urban studies from Hunter College. Welcome to Healthline, Nicole.
Thanks so much. I'm so happy to be here.
I like to start each episode of our podcast with understanding your why, as to why you're in this field. So what initially drew you into caregiving work and start your organizations?
So that might be a little bit of a long story, but let me start and try to make it concise. So I am the youngest of 6 children, grew up on Long Island, and my oldest brother was born with a heart condition. And we are a very supportive and loving family. He was an adult and lived in Manhattan. And he was very prone to pneumonia because of his heart condition. So he had thought he had pneumonia, but the doctor said, no, you don't have pneumonia. And they thought that he was struggling with depression, which was challenging and difficult and unusual, really, for him. But that's what we were told, and so we rallied around. Then my dad got a call about a week or so later, and my dad rushed to Manhattan, and my brother, unfortunately, passed away in my dad's arms. And that is because the doctor never looked at the scan. He had pneumonia the whole time. I would love to say that this is so rare, but it's not. Unfortunately, preventable medical errors happen a lot. Fast forwarding, my dad was diagnosed with Alzheimer's, dementia, and Parkinson's disease. And he would have these silent seizures, meaning he didn't shake or anything. It wasn't a movement. He was just kind of not there for a little bit. His eyes were open. And so he went into the hospital and then from there to a rehab. At that point, I had a lot of knowledge. I went in, I made sure they had all of the medications. I made sure that he was getting the care that he needed, make sure that all of his diagnoses were correct. But when I went to pick him up for one of my brother's weddings, he was not able to walk. He wasn't able to communicate. And I'd seen him just the day before, and he was fine. What ended up happening is they neglected to give him one of his medications. And that unfortunately led to him being in a nursing home for the rest of his life. So again, not uncommon, sadly. The work that I started even 26 years ago in DC, I still see some of the same things happening from when I did that advocacy work that long ago. Obviously, there's been some great things that are happening that are helping patients and their families, but we really have to advocate for ourselves. And those were my why moments, personally and professionally, about how every one of us as patients and as loved ones and family members really need to be able to advocate effectively so that we can get our best care.
Well, thank you for sharing the story about both your brother and your father. It's understandable why those experiences motivates you to do the work that you do. So my understanding is that Care Answered, one of your organizations, was developed as a solution to advocate for one's best care and to give caregivers peace of mind. Can you tell us more about the services offered by Care Answered?
Our mission is to access the best care for our clients while giving loved ones peace of mind and empowering all patients. And this comes from my professional and personal experience. What we do at Care Answered is really focus on transitions of care. And what I mean by that is when somebody has been diagnosed with a catastrophic or chronic illness, or they were diagnosed a while ago, but there's more symptoms or the symptoms are more severe. And people are really looking for what are the options. And it's very daunting and overwhelming for many caregivers as well as patients to be in that situation, because if it's your person, right, your special person, it's really hard to clear the fog and to ask the right questions and know what the questions are. And there's a lot of feeling of dissatisfaction within oneself or guilt, which should not be there, because the policies are changing all the time. The science is changing all the time. How would you know this? Really, Care Answered was created to be that help, that support, that advocate, those people asking the right questions to get the answers that you need. And so, again, we really focus on transitions. So in or out of a hospital, in or out of a skilled nursing facility, also known as a rehab or a nursing home, when somebody needs to utilize potentially their long-term care insurance. What we find with insurance oftentimes is if you have the money, it's easy to get. The real struggle comes when you need the benefit that you've paid into. So we do a lot of work around there. Also, within New York, there's something called community Medicaid, where you can get care for a loved one or yourself in your home. That is a program that, again, policies change all the time. There's a financial requirement and a medical requirement. And so really we do a lot of work around both of those, but I specifically do a lot around the advocacy for the care, because it could be to that person and to everybody around them that clearly mom, dad, sister, brother, spouse, whomever needs care in the home to have quality of life. But if you don't know the policies and you don't know what it is that they're asking, you can be denied that care that you so need. So we're in all of those kinds of transitions. Also when there's just more needs at home, right? People want to potentially age in place, and they're looking for, how do we make this easier, safer, better, increasing quality of life? Or if their home is not the right fit, what other choices are there? Or what other communities can they be in? Or what other activities could they participate in?
And I understand you also have some other services like periodic check-ins with care providers and mediating patient-family healthcare discussions and deciphering and streamlining medical bills. Can you tell us more about those services?
Yeah, absolutely. So I kind of call it choose your own adventure, because everybody needs different kinds of services and care. So the first thing we do is come up with, okay, what's the plan? What exactly do you need, do you want in your life? And the family is obviously part of that, those who have family and loved ones nearby or far away. We can always incorporate everybody, and their healthcare team. So we want to make sure all of the options are there. And then sometimes, as you just mentioned, the family's not on the same page. And families have different dynamics. That's just the way it is. I get a call oftentimes like, oh, my family is so different. And I was like, every family is so different. And that's the beauty and the challenge of family, right? What we do is we make sure that everybody's hearing the same thing. And sometimes hearing it from a professional like myself versus your sister or brother, or for a parent hearing it from their child, even though that they're grown and they may have all of this experience, they still might see them as their child, right? So they're not quite listening with the same ear. So I come in and make sure that everybody is on the same page, and our whole goal is for my client to really access the care that they want and that they need. So that mediation and those discussions, both with the family and with providers, are so integral to anybody's quality of life and their quality of care. And then there's bills, right? Bills are a big problem, medical bills. New York State has done a lot of good things as far as policy in regard to medical bills and owing them. I could do a whole other podcast about that. But there have been changes made so that it makes it a little easier. But people get things like their estimation of benefits, and they think it is a bill. And so just that education itself is really helpful for people, because I said if it's not a bill, it's not a bill. If it doesn't say pay by credit card, pay by check, that's not a bill. And we're here to help you understand that. If necessary, if you're fighting for a bill or really feel like you don't owe that, then we can help you and refer you to some partners that just do billing. Because sometimes, Care Answered, we do a lot, but we know what we know and we know what we don't know. Mm-hmm. And so we will find the experts for you for whatever need it is that you have.
Right. I know personally I have received those mailings where I'm thinking it may be a bill, but it's an explanation of the bill. I'm like, oh, phew, okay, thank goodness. So when people contact you for help, what happens? What's the first step that you have them take when they contact you?
Well, the first step they take is to contact me, right? And then we have a short discussion, which is free of charge, to see what it is that they're looking for, what is their need. I just had a call earlier today from a potential client that said she needed one thing, but then in that discussion of 15 minutes, I realized, I think what you actually need is this. Does this sound right? And she's like, yes, that is what I need. So many people just don't know what they don't know. So they think they want one thing and they're not sure. They don't know what their options are, and that's our job. So the first thing is that. And then if they feel like we're a good fit, then we have a intake consultation. And that's much more in depth to find out all of the needs, all the care needs, all the medical history, basically everything about that person, so that we can really understand what their options are and what the next steps are. So that's generally what we do. But we also have Ask the Advocate. So that is when people speak to us for those 10, 15 minutes. And I say, yes, I need your help right now. Somebody's being discharged from a hospital and it doesn't seem right. I don't have anything in place. I don't even know how this is going to work. That is an Ask the Advocate question in which we come in generally right away and make it make sense. Mm-hmm. And then if they want to further utilize us, we can then be the liaison, like we are with many of our clients, with any of the care providers, and again, be the coordinator for their care, so that, again, everybody's on the same page and understanding this is a whole human being, and we have to think about all aspects of them.
And I can imagine, I have my own experience as a caregiver when my father has suffered a stroke. And unfortunately, my parents didn't do much to prepare for that moment. We were immediately in crisis, trying to figure out, okay, how do we navigate this very complex system? So of those who do contact you, are majority of them are in crisis, or some of them calling you in advance to prepare for something that they know is inevitable? What are you seeing out there?
So what I'm seeing is that most people call in a crisis. Mm-hmm. I wish people didn't call in a crisis, but that's part of the Empowering All Patients. Part of our mission that we try to do is because people don't talk about it in our society. They don't talk about what it means to age, because aging begins when you're born. Mm-hmm. But we kind of kick that can down the road and don't think about it. I would love a society in which we were always talking about what we want to do for the rest of our lives, right? And in that dream quality. I just wrote a blog last month or this month about that. It doesn't have to be disaster. It has to be, what do you want? How do you want to live the rest of your life? It could be romantic, it could be sports, it could be travel, it could be whatever it is. But how you want to live your life, no matter what age, that's a conversation to have, because then you can put the things together to make that happen. So there are some people that do come to me beforehand, and they're thinking, I had a client call me earlier this week that was saying, my dad's getting older, I'm getting older. We did all of these things on paper, like a healthcare proxy, which allows people to make medical decisions for you if you're incapacitated. But I don't really know what all of that means. I put it down on paper, but I need help deciphering that now. That is so wise, because even when we are smart enough or have the knowledge and know-how to get that stuff on paper, it's just as important to have those conversations consistently. Because what we wanted 5 years ago, 10 years ago, maybe 2 weeks ago before we had this diagnosis is very different. And we have to have those who we trust know about our medical conditions, know about our prescriptions, and having those conversations about what you want to do for the rest of your life. So those folks that do come to us or have gone to other people to put those plans in place, it's just like anything else that you kick down the road, right? Mm-hmm. There is such a satisfaction of doing those things, of putting those into place, because that's a worry that's in yourself that you just are denying. And when you get it done, you're like, I feel lighter, because you've had that discussion, because you've put these things in place, because you've called Care Answered and had all these things done. It just makes life easier. We can have these conversations. We don't need to be scared about them. They're actually kind of exciting. Like when we travel, we think of travel plans, we're not like, exactly. Right? Yeah. We're like, oh, this is exciting, something that I want to talk about and I want to do. I hope that one day that we'll all be like that.
Yeah. And actually, this may be a great segue into your book. So you have a best-selling book. You're an author, and you've written the book entitled From Crisis to Calm. So can you tell us more about the book, and why did you feel the need to write this book?
So it all comes back again to the mission, right? Mm-hmm. So Care Answered is not going to be able to help every single person out there in this world. But I felt that if I wrote a book and gave people the tools and the knowledge about different questions that they need to ask when in different scenarios, different providers that they can have to help alleviate a need or meet a need, then that gives them more potential to advocate for their best care. So that's why I wrote it. I'm very proud of it. It's my first book. It does need to be redone again because, again, as I said before, policies and everything change. But it's definitely a great starter kit for people so that they feel empowered when going to a doctor's appointment or when advocating for a loved one or in a situation when they're in a healthcare facility, so that they know, hey, there's instructions here for me to do so that I can follow and get better care.
And in addition to your organization, Care Answered, you also have another organization called Answers for Care. Can you tell us more about that organization and why you felt the need to develop the second organization?
The vision for Care Answered and for Answers for Care, and I guess just for me as a person, is that everyone can easily access the care they need. And that's my big vision. Answers for Care is from that as well. With Care Answered, we do a lot of coordination. There's people that have expertise, like doctors, that have expertise, and the clients themselves who have the expertise in themselves. So there are other providers that do excellent work. And on the business side of things, because, as I mentioned, as a society, we don't talk about these things enough, oftentimes they're not known. People don't know that these services are out there, and they're so valuable to families. So one of the reasons is to get that out there to people. And Answers for Care only has members on it that provide a range of services that are fully vetted. So the 50% or more owners are criminally background checked. The business is background checked. They have to be rated well on either a Google-type platform or professional platform or CMS for those that understand what that is. That's a Medicare category. The government rates them. So they have to be very well rated. And it's exclusive because nobody needs a phone book being thrown at them when they're trying to figure out the best services. So it's 4 per category, so specialization per geographical area. So we're in Nassau and Suffolk right now. And so we have basically the best of the best providers. Mm-hmm. And they're there for you, and they're easy to find, and you can trust them, which is very difficult because there are bad actors, unfortunately, in every form of service. When you go to Answers for Care, that's not the case. So we have everything from elder law attorneys to financial advisors to transportation, wheelchair transportation, to patient advocates, home care agencies, pre-planning for funerals, all of these things, and more. So we provide various services for top-notch providers that you can easily get. And if you have any questions, if you're like, oh my gosh, these are great services, I don't even know what I need, you can give us a call and we'll certainly help you navigate that.
Sounds good. Overall, it sounds like you're just doing an amazing job empowering patients. You shared so many valuable insights today. So what are a few practical steps or strategies you recommend patients and families take to make sure they're getting the care and support they deserve, especially when navigating long-term care?
The most important thing for caregivers, I would say, is to remember you are not alone. There are more caregivers than those who are not caregivers. So you are not alone. It can feel very isolating. It can feel like you're in it by yourself, but that's not the case. So that's the first thing that I would say. The other is, as I alluded to before, is these conversations with your community, with your loved ones, with your clinicians. Having these conversations about what you want. If you don't understand something, ask again. Ask until you understand. It is not your job, even if you are a physician, to understand what that other physician is saying. It does not matter. This is you or this is the person you love, so things can get hazy. So ask until you understand. Get an advocate. I have my own advocate when I'm hospitalized. I believe everyone needs one. Just know that not only are you not alone, but there's all of these services out there. We've made it on Long Island anyway, so that you can have ones that you can really count on and know. Don't be shy to ask for help from family, friends, colleagues, neighbors, because again, you're not alone. So ask for help. That is not weakness. That is strength. We are here to help each other. That's what I believe. And there's lots of help out there. So ask for help. Don't think that you need to do it alone. Do not feel guilty about not having all the answers. Nobody does. So that's what I would suggest. That there's a number of things. That's what I would suggest that people really think about in order to really find the best care and find the professional that's right for you.
I want to mention that last month, November, was National Family Caregivers Month. And I know that many in the field, including yourself, participated, attended a number of conferences, symposiums, and events focused on caregiving. I would love to hear your perspective. So what were some of the key highlights or takeaways from the event? So great to see you at Hofstra's third annual Caregiver Summit that we hosted in collaboration with a number of sponsors. So that was one, I'm sure, of many different events that you attended. What were some of the key highlights and takeaways that you found useful from those events?
Well, thank you. And that event was amazing, first of all. I really got a lot from that event because they put us in focus groups so that we could speak with people, different caregivers, professional caregivers, non-professional caregivers. It was really quite wonderful. And I learned a lot. We also, in that symposium, watched the movie, the caregiver movie.
Caregiving.
Right, with Bradley Cooper.
Yeah,
Is that his name?
Yeah, he wasn't there.
He's pretty famous. Yeah. He wasn't there. It was very thought-provoking. The entire thing was very thought-provoking, not just the movie. And I got a lot from listening to people that were caregivers themselves. Obviously, I'm always in that realm by what I do. I'm often speaking with caregivers, but it always gives me insight about what other people are struggling with, how one's culture or lack of identifiable other people in your same culture that can help you in a different caregiving situation. Again, going back to we're not alone, but people feel like they're alone. Also, I learned a lot about the policies that are taking place now. There's a number of them. So it was really heartening to see how many people were understanding these policies that were taking place and advocating for not only themselves and their loved ones, but anybody facing these kinds of caregiving situations and making our voice heard. I guess the best way to describe myself is I am an advocate in general. When we advocate together, our voices are made louder. That is so important, I believe. having these conversations. Somebody came up to me with a crisis, because that's what happens, right? I'm in the symposium and somebody came up to me and I was like, okay, this is what you need to do. 1, 2, 3. And they were so grateful. It was one of those things, like, you've come to the right place. When you're in a situation where people are struggling or you're struggling and people are there for you, that always is a good thing. So for all of you caregivers, professional or family or friend caregivers, know that there's these symposiums around. There's a whole month dedicated to us. So go out there and check them out, because I know you're the busiest people around, and that's why I created things like Care Answered and Answers for Care. But that's also why they have these great symposiums going around. Although you're so busy, that self-care, that understanding that you have a community behind you is so important for your own self.
Fully agree. So we're about to wrap up, but before we do, I wanted to ask, what continues to motivate you?
Caregivers and patients, to be honest. People in general. Everybody's going through different things and trying to figure out what's the best way that their needs can be met. I learned that because I'm so grateful that I'm around people all the time that are willing to share these things with me and share these experiences, so that I learn and can talk to other professionals to see how we can make it better and do more advocacy on the policy level as well to make things better. So people motivate me. So thank you, caregivers and all those in this field that are doing such great work.
What's the best way for people to reach you?
The way to contact me at Care Answered is 516-584-2007, extension 1. You can email me at Nicole, that's Nicole, at careanswered.com, or you can go to the website of careanswered.com. And for Answers for Care, which again is a one-stop shop, a village of senior care solutions, that is answers4care.com.
Great. Well, thank you so much, Nicole, for being on our podcast today. Thank you for all the amazing work that you do, and just for being that support for caregivers in our area. So thank you for all that you do.
Thanks so much.
You're welcome. So that wraps up another episode of The Health Line, Issues That Shape Our Wellbeing. I would like to thank our studio engineer, John Mullen. I would like to thank WRHU Radio Hofstra for their help with the production of this podcast. Lastly, I would like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Ault-Brutus, and thank you for listening. Have a great day.
Bye.